Welcome to NeuroVerse, inspiring minds, empowering life through neuro knowledge.
Hello everyone, I am Dr. Kishore, neurologist and epileptologist. Today I am here to speak about stroke. So, what is stroke? Stroke broadly two types, that is ischemic stroke, also called as clotting stroke, and hemorrhagic stroke, also called as bleeding stroke. Now let us discuss about clotting stroke. Clotting stroke means what? So for example, how houses have pipes to carry water, we also have pipes which are also called as arteries which carry the blood. If there is any block in the pipes, the blood won't move forward, and if blood is not moving forward, the brain will not get enough oxygen, nutrients, and it is not able to sustain. It is called as stroke. So, how do we identify stroke? So, this stroke can happen to anybody at any point of time. So, as we all know, brain has different functions in different parts of the brain. For example, right side of the brain controls the left hand and leg movements. Left side of the brain controls right upper and lower limbs, that is right hand and leg. Other than that, we have an area for speech, understanding language, and for vision, for balance. There are many areas of the brain for processing, memory, and they are all interconnected. So wherever the stroke may happen, based on the area of involvement, so symptoms can arise. So majority of patients can have slurred speech, facial asymmetry, drooping to one side, vision impairment to one side, hands or legs not working properly. There can be some numbness or paresthesias of the hands and legs, imbalance while walking. They can have giddiness, vomiting and falls. There can be sometimes unconsciousness also. So these are the symptoms. Based on where the stroke has happened, symptoms will vary. But theoretically, anything can be because of stroke. Any symptoms can be presented because of the stroke. So most important point here is the sudden onset. Somebody was completely normal and bam, suddenly if there is any problem, we have to consider vascular event, also called as stroke. So now coming to why this stroke happens. These are the risk factors of the stroke. So what are these risk factors? Modifiable, that is which is in our hand, and non-modifiable, that is which is not in our hand. So modifiable, non-modifiable risk factors are the age, which we can't change, gender we can't change, and also previous stroke, previous cardiac heart attacks is also a risk factors which we can't change. Next, coming to the modifiable risk factors. Modifiable risk factors means something which we can do something about it, like diabetes, hypertension, smoking, and regular drinking, alcohol consumption. And also the other causes are OSA, that is obstructive sleep apnea, which is seen in patients with continuous snoring in the night. That is also one of the risk factor. And there are many other risk factors like high cholesterol and all those things. Those are all modifiable risk factors. Thank you everyone.